I'm Dr. McDonald. I'm the Director of Emergency Care at Sydney Adventist Hospital. We started a syncope clinic because lots of people faint, and in the northern area of Sydney we have an older demographic, and older people faint more than younger people. So lots of people pass out. Somewhere around 4 an hour in Sydney are going to pass out. And about every hour somebody's going to hurt themselves. And every few hours one of those people who's passed out has got a heart problem that probably needs to be sorted out. And most of those patients either have a benign cause of syncope where they'll be okay, or they go and see somebody and get sorted out eventually. But some of those patients are going to pass out and have a condition that might be really dangerous for them. So we thought that we should try to help the people who are passing out, who have a really dangerous condition, but also help people who are passing out from less serious causes, but who need a bit of help and guidance with their risk factors, with their medications. That's a bit complicated. So we thought the best way to do it was to get all the resources of doctors who know their business and a hospital who has lots of diagnostic and interventional resources, get them all together and help these patients. So that was the idea. Hence a faints and blackouts clinic. So what we do is we have a general specialist. I'm one of them. We have 2 other geriatricians who see the patients in the first instance. The patients do a fairly detailed questionnaire and they give that information to a nurse before they see the doctor, and they have some observations, an ECG and some blood tests done. Then the general doctor makes a judgment about the likely diagnosis. Again, most patients who we see will have a diagnosis of orthostatic postural syncope, sometimes vasovagal or reflex syncope. Those aren't serious in themselves. The act can hurt the person, but they're not serious in themselves. They're manageable. Some of the patients will have cardiac syncope, and then we will arrange appropriate investigations. If we're not sure, or the patient's complicated, we will refer to a multidisciplinary team where we will have a cardiologist, a neurologist, and a geriatrician to try to work out what is going on and what's the next best intervention. We will also organise some investigations. We might need to do some brain scans, or we might need to do some heart scans. We can do some additional stuff beyond that initial workup. Often patients will need a cardiac echo as well, and we can do that on the day of the first consult. If we think they might have a valve problem or a structural heart problem, that's an important cardiac cause, we can sort that out on the day in terms of that diagnosis. But we really think that a lot of these patients will need a multidisciplinary team to direct and target the appropriate investigations and eventually the appropriate interventions. So that's why we started it, and that's sort of how we do it now. And we've already had a couple of patients with cardiac conditions that we've referred for further investigation. And we've had a number of grateful patients who've had vasovagal or orthostatic syncope, who we've given some advice, some medication modification, and some tricks about how not to faint when you feel like you're going to faint. So we've started off well. If patients faint and are worried about the cause, if they are concerned about what's happened to them, they should see somebody. If the event is serious and they hurt themselves, they're going to see an emergency department. But they should go and see a GP. And the GP then has the option to refer the patient to us. If the GP is trying to work this out in outpatient services through referral. Most of these patients are going to see 2 or 3 specialists, get a dozen investigations over a period of time, and the answer may still be a bit elusive. So it's probably better for the patient and the general practitioner to just refer to a single clinic where an expert or a series of experts can work out what's going on, arrange appropriate tests. So I think that's the advantage of having a single clinic with all the resources around it, all the intellectual and physical resources around it.